We're exploring different ways that wellbeing teams and community circles can support people around health, and this is one of them, supporting people to come home from hospital. Here's one way that this could look. When people arrive in hospital, as part of their welcome pack, they could be given a leaflet about community circles, a mini one-page profile and contact details of the Community Circle Connector and when she'll be on the ward. This is a role that Helen Smith did on a hospital ward in Preston. The Community Circle Connector would then meet with the person and explain about circles and how they work. The connector and the wellbeing leader would be part of the multidisciplinary discharge team. When someone's getting ready to go home, the wellbeing leader would support them to choose their link wellbeing worker, and together with other relevant people, for example the occupational therapist, they'd co-design the discharge and initial support from home. This will take into account what matters to the person and their priorities, as well as what's needed to keep them safe and well, and linking with family if they're involved. The Community Circle Connector also explores with the person whether they want to start their circle straight away or later when the person's re-established at home. The Link Wellbeing Worker coordinates the person leaving hospital with the relevant professionals and will actually bring them home too if necessary. They ensure that they're welcomed home with fresh sheets, milk in the fridge or flowers or whatever it takes for the person to feel welcomed. The Link Wellbeing Worker is also part of the person's team and brings in other team members as required to make sure they get the day-to-day support to enable them to be safe and well. But not just about being safe and well, the wellbeing team works using enablement principles, including the support sequence to focus on self-care, using technology, involving friends and family, and the community circle if this is started. At 6 to 8 weeks, there's a person-centred review with the team, the circle, the social worker, and any health professionals who are involved. The social worker will have done an assessment to identify the person's outcomes and whether they're eligible at this stage for a personal budget. The Link Wellbeing Worker and the person themselves then co-design their service going forward within their budget to achieve their outcomes, and the person may expand their team if that's necessary. This approach provides continuity for the person from hospital to home without having a separate enablement team and a separate home care team. It integrates the support that's provided by the family, friends and voluntary sector through the role of the Community Circle Connector. And re-ablement and community navigation are built into the very heart of the way the wellbeing team and the Community Circle Connectors work. We've got some experience so far of putting elements of this into practice. There's a Community Circle Connector at Age UK Doncaster, and she's linked to their home from hospital service. A Community Circle Connector, Helen Smith, also worked for a year linked to a discharge team at a hospital ward in Preston. The wellbeing teams in Devon have demonstrated how people's support can be reduced over time. For example, one person started with over 42 hours support, and 6 weeks later this had been reduced significantly. We're exploring different ways and different places to put this into practice, and if you'd like to stay in touch with what we're trying and learning, please go to wellbeingteams.org and sign up for our regular newsletter. Thank you.